Hello, today we will deal with introduction to neuroanatomy and external features of spinal cord. Neuroanatomy is the study of nervous system. Nervous system along with endocrine system regulates functions of all other systems in body. So it can be labeled as master system of the body. It is divided into CNS and PNS. CNS, that is central nervous system, includes brain and spinal cord, while PNS, that is peripheral nervous system, includes 12 pairs of cranial nerves and 31 pairs of spinal nerve. In addition, ganglia associated with cranial and spinal nerves. Brain is well protected in the cranial cavity, while spinal cord protected within the vertebral canal. CNS is responsible for integrating, processing and coordinating sensory data and gives appropriate motor commands. PNS provides afferent impulses to CNS and carries efferent impulses to the effector organs like muscles, glands and blood vessels. So the parts of the brain we can learn from this figure, or actually it's not figure, it is a section of the brain, mid-sagittal section. So the forebrain that contain cerebrum, that is two cerebral hemisphere on either side, and the diencephalon that is hidden in the cerebrum that continues as midbrain. Now midbrain continues as hindbrain, that is having, this is the pons anteriorly and this is the cerebellum posteriorly, and further it continues as medulla oblongata. The medulla oblongata further continues as spinal cord. Spinal cord is an elongated and cylindrical part of central nervous system. It occupies the upper two-thirds of the vertebral canal. It retains the primitive form of CNS. The functions are execution of simple reflexes, then transmission of impulses to the brain and from the brain. Spinal cord is a continuation of medulla oblongata. It extends from the upper border of the first cervical vertebra to the lower border of the first lumbar vertebra. It shows two enlargements. One is cervical enlargement and other one is lumbar enlargement. The cervical enlargement is to occupy the more nerve fibers that supplies the muscle of the upper limb, and the lumbar enlargement is to occupy the neurons that supplies the lower limb. The cervical enlargement extends from third segment to cervical third segment to T2 segment, and the maximum circumference lies at the C6 segment. Similarly, the lumbar segment extends from the L1 to S3, and the maximum circumference lies at the S1 segment, and it is about 35 millimeter. The spinal cord ends in a triangular structure that is called as conus medullaris that lies at the lower border of the L1. The length of the spinal cord is 45 cm in males, 42 cm in females. The weight of the spinal cord is 30 grams. In the intrauterine life, this yellow color is the spinal cord, and this is the vertebral column. Up to third month of intrauterine life, the spinal cord occupies the entire vertebral column. In the first figure you can see. But after third month of intrauterine life, the vertebral columns grows rapidly than the spinal cord. Due to this disproportionate growth at the time of birth, in the second figure you can see the spinal cord is only up to the lower border of the L3, and even after the birth up to the puberty, this disproportionate growth continues, and the spinal cord in the adult reaches lower border of the L1. Spinal cord is covered by three layers: dura mater, outermost, and arachnoid mater and pia mater. So you can see the dura mater, outermost, the green color one, then arachnoid mater, then this is the pia mater. The pia mater completely invests the spinal cord. The space between the vertebral canal and dura mater is epidural space. The space between the dura mater and arachnoid mater is the subdural space, while the space between the arachnoid mater and pia mater is subarachnoid space. The subarachnoid space is important. It contains cerebrospinal fluid, which acts as a shock absorber of the spinal cord. Now, this pia mater, innermost pia mater, that is closely investing the spinal cord, it modifies as phylum terminale. See again the lower end of the spinal cord, that is conus medullaris. Here the pia mater fuses to form a fibrous structure that extends from the apex of the conus medullaris to the dorsal surface of the first coccygeal vertebra. So this is called as phylum terminale. So this phylum terminale holds in position, the spinal cord is held in position, so it helps in supporting the spinal cord. Now second modification is the ligamentum denticula. Here again you can see the innermost layer, that is the pyometer. It forms the teeth-like projection on either side. So this teeth-like projection first pierces the arachnoid matter, then it is attached to the inner surface of the dura mater. So there are 23 pairs of ligamentum denticula on either side. They protect or they helps in lateral support of the spinal cord. Now we can see the external fissures and sulci of the spinal cord. The anterior aspect of the spinal cord presents anterior median fissure and two anterolateral sulci. Similarly, the posterior aspect of the spinal cord presents posteromedian sulcus and two posterolateral sulci. The anterior median fissure is deep and extends along the entire length of the cord. The anterior spinal artery runs in it. The posterior median sulcus is a faint longitudinal groove. From the floor of the posterior median sulcus, a septum of neuroglial tissue, that is posterior median septum, extend into the substance of spinal cord. Now through the anterolateral sulcus emerge the ventral root fibers, and similarly through the posterolateral sulcus enter the dorsal root fibers of spinal nerve. Here once again you see the anterolateral sulcus that gives attachment to the rootlets here and on either side, and similarly there is rootlets in the posteromedian sulcus. So these rootlets unite to form root. So this is the posterior root and this is the anterior root. These both anterior root and posterior root in turn unite to form spinal nerve. So this part of the segment that gives attachment to the pair of spinal nerve is called as spinal segment. There are 31 pairs of spinal nerve, hence there are 31 spinal segments are there. So as vertebral column is segmented, that is what body of the vertebra, then intervertebral disc. So vertebral column is segmented. Similarly, the spinal cord is also segmented. You can see here the vertebral column extends from the first cervical to the coccyx, but the spinal cord extends from upper border of C1 to the lower border of L1. So this means that spinal segments are shorter than the vertebral segment and they are crowded also. So it is clear that the spinal segments are higher than the vertebral segment. For example, we can count the vertebral column by palpating the spines. So if you palpate C7 spine, here you can see C7 spine. Okay, C7 spine. So here you have to add 1, that is C7 plus 1, that is the C8. 8 spinal segment is present here. Similarly, in case of thoracic vertebra, upper thoracic vertebra, T4 level. You have to T4 level, you have to add 2, that is 4 plus 2. So here C6 segment is present. C6 segment is present. And in case of lower thoracic, you have to add 3. So in such way, you have to locate the spinal segment below the particular vertebral spine. This knowledge is useful for the surgical procedure in which laminectomy is done for relieving the cord compression. So this is the formula that you can detect the spinal segment below the vertebral level. So you have to add in the upper cervical, you have to add 0. In lower cervical, you have to add 1. In upper thoracic, you have to add 2. In lower thoracic, you have to add 3. Like this, you have to detect the spinal segment below the vertebral segment. So cauda equina. So you see the focus, the lower end of the spinal cord, that is conus medullaris, that is ends at the L1. It gives on either side lower 4 lumbar spinal nerves, 5 sacral and 1 pair of coccygeal. So total there are 10 nerves on 10 nerves one side and 20 nerves on either side. Each nerve is having 2 roots. So total 40 nerve roots are on either side of the phylum terminale. So here these nerves are oblique and longer, and in the central there is phylum terminale. On either side these nerve roots are there. This appears as a tail of horse, hence it is called as cauda equina. Lumbar puncture is done for diagnostic and therapeutic purpose. So it is to obtain the cerebrospinal fluid by using lumbar puncture needle from the subarachnoid space. So here the patient is lying on the side. So when the full flexion is done, the interspinous spaces, they separated at their maximum level. So yeah, the interspinous space between the L3 and L4 is preferred to avoid injury to the spinal cord. In this full flexion, the spinal cord ascend upward, is present at the lower border of the T12. An imaginary line that joining the two iliac crest, highest point of iliac crest, that passes through the L4 vertebra. Above this L4 vertebra, the space is in between the L3 and L4 vertebra. This space is used, and the lumbar puncture needle is inserted in between L3 and L4 space and reach the subarachnoid space, and cerebrospinal fluid is obtained for the various diagnostic and therapeutic purpose. Through the same needle only, anesthetic agent can be injected, so that is called as spinal anesthesia. The spinal anesthesia is useful for the surgeries in the lower abdomen, pelvis and lower limb. Thank you.